Hiller. I'm going to be your student nurse today. Is that okay with you?
Yeah.
All right. Can I get your name and your date of birth, please?
Dalen Harris, 102604.
All right. And can you tell me where we are right now?
We're at Saginaw Valley State University.
All right. And then what year is it?
2025.
Okay. So you are A&O times 3, so I feel comfortable continuing with this assessment. I'm just going to ask you a few personal questions. All right?
Mm-hmm.
All right. So first, are you on any medications that I should know about?
No.
Okay. Are you allergic to anything? And this could include seasonal allergies.
I have hives right now. I might be allergic to a medication.
Okay. And what medication would that be?
Moxicillin.
All right. And are the hives painful or anything?
No, just itchy. I'm getting treated for it, so then they're going away. They come and go.
Okay. All right. And do you have any diagnoses that I should know about?
No.
Any family history with heart disease or lungs or any issues like that?
No.
Okay. Do you have any past surgeries?
No.
What's your normal exercise like on a weekly basis?
I like to take a walk for at least like 30 minutes to an hour a week.
Okay, so about 30 to an hour of exercise a week on average?
Mm-hmm.
Okay. What's your normal diet like?
The normal. I eat like breakfast sometimes, and then I eat lunch and dinner. And then I sometimes have a snack later on, but I usually eat like fruits and vegetables and protein.
Okay. And how often do you drink alcohol?
I don't.
Okay. And how often would you say you smoke? This includes weed, vapes, or anything like that, tobacco?
Nope. I
Not at
don't.
all? Okay. So I'm going to continue with this assessment. I'm going to take some vitals. Is that okay with you?
Yeah.
All right. So I'm going to start with your blood pressure. Do you prefer a specific arm?
No.
Okay. Is your blood pressure normally high, low, or anything like that?
It runs a little on the lower side, but it's in range.
Okay. And while I'm getting this on, do you have any pain right now on a scale of 1 to 10, 1 being no pain at all, and 10 being the worst pain of your life?
1.
1? Okay, good. You can just relax your arm. And I'm just going to pump it up to 140 since you said you're normally low. Alright. Yep, 114 over 76. So like you said, a little bit on the lower side, but still in range. Are you feeling any hot and cold chills right now?
No.
Alright, have you had a fever recently or anything like that?
No.
Okay. I'm just going to feel your temperature on your forehead. Alright, since we don't have a thermometer, I'm just going to assume, since you're not having any problems with your temperature and you feel okay, that you're between 97 and 98 degrees Fahrenheit. Okay? Now I'm just going to feel your pulse. Oh, you could take that off for me. Alright, respirations are 18 and pulse is 88, which are both really good. Could I see your hands really quickly? I'm just going to assess for any clubbing really quickly, which should tell your oxygenation. I don't see any, and are you feeling out of breath or anything right now?
No.
Okay, I don't see you using any accessory muscles, so I assume your oxygen is between 95 and 100% on room air, and all your vitals are fine, so I feel confident continuing with the assessment. Is that okay with you?
Yeah.
All right, I'm going to start with your arms. First, I'm going to look for symmetry with your pulses, so if you put your hands out like this. All right, both your radial pulses are symmetrical and in good rhythm. And both your brachial pulses are symmetrical and within rhythm. Okay, now I'm just going to take a look at your arms. All right, I don't notice any bruising, any lesions, any discoloration, or any lumps. I notice a few moles, but they all look symmetrical and normal. All right, same thing with this side, and your arms look symmetrical, so I'm not worried about anything there. So now I'm going to see your hands again. I can see a little bit of your nail bed above, like under your nail polish, so I'm going to do some cap refill, and I'm going to look at the top. All right. And those are under 3 seconds, but just to be safe, I'm going to look at the bottom of your hands too. Good. So your perfusion is good. Now I'm just going to assess some of your muscle tone. So I'm just going to squeeze your arm a little bit. All right, muscle tone on that arm is good. Did you feel any pain?
No.
Okay. I notice you have a little bruise here. What's that from?
I got my lab work done.
Lab work done? You got some blood work done?
Mm-hmm.
Okay. All right. And now I'm just going to have you do some muscle exercises. So if you can put your hands like this for me. I'm going to push out, and I want you to push inwards. Good. And opposite. Now flip your hands over. I'm going to push up, you push down. And the other way. Okay, good. And now I'm just going to have you do some range of motion exercises. So if you could rotate your wrists like this for me, I'm just going to hang on to your wrists. Is there any pain there?
No.
I noticed a couple crackles. Is that normal for you?
Yeah.
Okay, good. I'm going to put my arm on your elbow, my hand on your elbow, and I just want you to flex your arm up for me. Good. Same with this side. Good. All right, and do you know how to swim?
Yeah.
I'm going to have you do like 2 to 3 front strokes and then 2 to 3 back strokes. And I'm just going to put my hand on your shoulder while you're doing that. And let me know if you're in any pain during this. Any pain at all?
No.
Good. Same thing with this side. All right. Lastly, I'm just going to test your cerebellar function. So if you could make the OK symbol for me and just go to the next one, all the way back, and then do that as fast as you can. Good. Now put your hands on your legs, flip them over, flip them back, and do that as fast as you can. Good. And one more thing for cerebellar function. I'm going to have you touch your nose, and then when I tell you, I'm going to have you touch my pen light. Pen light, nose, pen light, nose, pen light, nose, pen light, nose. Good. So your cerebellar function is good, so I feel comfortable continuing with this assessment. I'm going to start with my cranial nerves. You have 12 of them. 1, 2, and 8 are going to be your sensory nerves. 5, 7, 9, and 10 are going to be your motor and sensory nerves, and then the rest of them are just your motor nerves, okay?
Mm-hmm.
So I'm going to start with number 1. That's going to be your olfactory nerve. I want you to close your eyes and tell me what you smell.
Coffee.
Good. So that one's intact. I'm not worried about anything there. For cranial nerve number 2, we don't have a Snellen chart to properly test it, but do you have any problems with your eyes?
No.
All right. Do you need glasses or contacts or anything?
No.
Have you been to the eye doctor?
I have.
About how often do you go?
Once a year.
Okay, so I assume that your eyesight and cranial nerve number 2 is intact. For 3, 4, and 6, I'm just going to do the 6 cardinal fields of gaze. So I just want you to follow my pen light with just your eyes and not your head. All right, looks good to me. So those are all intact. Now I'm going to do cranial nerve number 5. So I'm going to have you close your eyes, and I'm just going to touch different parts of your face, and I want you to tell me where I'm touching.
Okay. Forehead. Left cheek. Right cheek. Nose. Chin.
Okay. Good. Now I'm just going to feel your jaw. Punch your jaw for me. Good, so cranial nerve number 5 is intact. For number 7, I'm just gonna have you make a couple funny faces. Blow up your cheeks for me. All right, frowny face, happy face, sad face, angry face. All right, so cranial nerve number 7 is intact. For cranial nerve number 8, do you have any problems with your ears or with your hearing?
No.
Okay, and we're gonna check that again back when we come to the Romberg test at the end of this assessment. But for now, you're hearing me fine, you're responding fine, so I assume your cranial nerve number 8 is intact. All right, for 9, 10, and 12, I'm gonna assess your mouth. So I'm looking at your lips right now. They look pink. They don't look chapped or anything, so I'm not worried about anything there. If you could smile at me, just show your teeth. All right, your teeth look okay. If you could pull down your lip. All right, all of your gums look okay. They look pink. They don't look, your mucous membranes look fine. So now I'm just gonna check at your gag reflex. So if you could stick your tongue out for me. All right, and then say ah.
Ah.
All right, your glow went up, so that's your gag reflex is fine. Then take a look at your tonsils. They aren't swollen. I don't see any tonsil stones. I don't see any lesions. Your mucous membrane is nice, and everything seems to be intact there. So I'm not worried about anything with that. And then finally, for cranial nerve number 11, I'm just gonna have you shrug your shoulders. Good. Okay, before I start with my head assessment, I'm just gonna take a look at your face. Do you have any problems with acne or anything?
No.
Okay. It looks like everything is fine. Your skin looks good. It doesn't look like there's any lesions, any lumps, or anything, any discoloration on your face. So I feel comfortable continuing with this assessment. First, I'm just gonna assess your hair. So I'm just gonna press on your scalp, and I want you to let me know if you're feeling any pain. Any pain?
No.
All right. So palpating your scalp is good. Now I'm just gonna look in your hair for any dandruff, any lesions, any bumps, anything out of the ordinary. Okay, and I don't notice anything, so that's good. Now I'm gonna take a look at your ears, so if you could pull your hair behind your ears for me, or put it up. Okay, thank you. I'm just gonna fix it a little bit. All right. Now if I'm looking at it from both sides, your ears look symmetrical. They don't look like there's any issues. I see you have a couple of piercings. Have you had any problems with those?
No.
Okay, good. Are they in pain or anything?
No.
All right. Now I'm just gonna take a look inside both of your ears. All right, everything's good on that side. Everything's good on that side. I'm gonna take a look behind your ears. All right, I don't notice any redness, any swelling. I don't see any issues. I don't see any lesions or anything inside your ears, so I'm not worried about anything. Now I'm gonna palpate, and I want you to tell me if you're feeling any pain. Any pain there?
No.
All right, and I didn't feel any lumps, so I don't see any issues with your ears. Now I'm gonna just test all of your lymph nodes, and I want you to tell me if you're feeling any pain during any of this. This is your occipital lymph node. This is your postauricular lymph node. And your preauricular lymph nodes. Any pain so far?
No.
Good. Here's your submandibular lymph nodes. Here's your submental lymph node. Any pain?
No.
All right. Your cervical chain. And if you could hunch your shoulders over for me. Here's your supraclavicular lymph nodes. And I'm going to check tissue turgor while I'm here. And there's no tenting, so I'm not worried about any dehydration. And did you have any pain during any of that?
No.
So there was no tenderness. All of your lymph nodes were non-palpable, and they were all movable, and I couldn't feel them. So I'm not worried about you having any sort of infections or any lymph node issues. All right. Now I'm just going to feel your sinuses. I'm going to feel your frontal and maxillary sinuses, and I just want you to tell me if you're feeling any pain once again. Any pain there?
No.
Oh. How about there?
No.
And that's your frontal, and that's your maxillary. Okay, now I'm just going to take a look at your nose. I know you have a piercing. Is that healed okay?
Yeah.
All right. Did it cause any pain or anything? Any infections?
No.
Good. Do you have any problems with smelling or anything like that?
Mm-mm.
Can you close one nostril and breathe in? All right. And the other one? Good. Now I'm just going to take a look up your nose. If you could look up for me. All right. I don't notice any septum deviation. Your mucous membrane is moist, so I'm not worried about anything there. and I don't notice any redness or swelling or polyps, so everything looks to be good in there. It seems like a nice pink color, so I'm not worried about anything. Now I'm just going to assess your eyes. First, I'm just going to look at your sclera and your conjunctiva. So I want you to look down, and I'm going to pull on your eyebrows up. Okay, and opposite. Good. So your sclera is white, which is good. It's not jaundiced, yellow, or blue from a medication reaction. And your conjunctiva is nice and pink. It's not red or white, which could indicate anemia. So I'm not worried about anything there. Do you have any sensitivity to light?
No.
Good. I'm just gonna have you look straight at my face. Good. 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 Okay. Then I'm gonna have you look at my hand and then look at my pen light. Hand, pen light. Hand, pen light. Alright, that's good. So your perla is intact, your pupils are round, they are reactive to light, and they are accommodating to distance, so I'm not worried about anything there. And now I'm just going to have you look up for me, and I'm going to assess your neck really quickly. So first, for inspection, everything looks okay. Your trachea looks to be straight. It doesn't look like it's any deviated to one side. You don't have any lumps, you don't have any lesions, and there's no redness. The color looks good, so I feel confident with being able to palpate. So I'm going to feel for your carotid arteries one at a time. That one's good, nice and strong. So is that one. I'm just gonna listen for any bruise, which sounds like some swishing noises. And I'm gonna, when I tell you to, I want you to hold your breath.
Okay.
Hold your breath for me. Good, breathe. If you can hold your breath for me again. Good. So I don't hear any wishing noises, so I'm not worried about you having any bruise in your carotid arteries. Now just really quickly, I'm going to go check out my paper, and then we can start with the next assessment. Alright. Now if I could just have you turn around for me without standing up. Alright, and just be aware I am going to reach around you to touch your neck, so just don't be scared of that. I'm going to push against your trachea, and I just want you to swallow when I tell you to, alright? Okay. Okay. I'm going to push against your trachea and swallow for me. Good. Same thing on this side. Swallow. Good. And I don't feel any abnormalities. Your thyroid isn't hard or anything, and I'm not feeling. And did that hurt you at all?
No.
Okay. So no tenderness. So I'm not worried about any hyper or hypothyroidism. Is it okay if I untie this?
Yeah.
Okay. Now I'm just going to assess your back really quickly. I'm looking at your spine, which is straight. I'm looking at your skin, and everything seems to be okay. All your moles seem to be normal shape and color and everything, so I'm not worried about that. Your back seems to be symmetrical. The back of your neck looks okay, and everything seems to be intact. So I'm just going to look at your 2-to-1 ratio. So I'm going to look at your back, and I'm just going to move this out to look at your side. Yep, and you have a 2-to-1 ratio, not a 1-to-1, so I'm not worried about any barrel chesting, which could indicate COPD or asthma. All right, now I'm just gonna have you have a deep breath, and I'm just gonna touch right here. All right, and just for reference, I'm gonna touch down here to make sure your lung tissues are down here. Good. So here is the end of your lung tissue, right at the bottom with your bra. And now I'm just going to auscultate lung sounds. I want you to raise your hand if you need a break. I am gonna have you take 12 deep breaths. So just be aware of that. And whenever I move my stethoscope, I want you to take a new deep breath, okay?
Okay.
Okay. Whenever you're ready. Sorry. Redo that. And for reference, I am right here. And I am right here. I'm right here. And last one. I'm right here. All right. Are you feeling any dizziness?
No.
Good. I heard clear lung sounds in all of your lung tissue, which is good. I didn't hear any wheezes or any crackles, so I'm not worried about any infections or pneumonia or any fluid in your lungs. Now I'm just going to percuss, so I'm going to do the same thing 12 different times, but it's just a percussion instead. Last two. For reference, I'm right here, and I was on that side too. All right, I heard resonance in all of your lung tissue, which is good. I didn't hear any dullness. That would indicate fluid once again in your lungs, so I'm not worried about anything there. And if you are comfortable, I can have you lay down for me. And put this blanket on me for privacy. This way. All right. Now I'm going to remove this pillow really quick and lay flat for me. Now I'm just going to have you look that way. All right. I don't see any jugular vein distension. Back this way. All right. No jugular vein distension. So that's good. If you did have some jugular vein distension, I would raise you at 45 degrees, but you don't, so that's okay. If you feel comfortable, can you take off the top of your gown? Good. You just have to reveal your chest for privacy reasons. Okay. And right now I'm inspecting your chest. I don't see any issues. I don't see any redness other than a little bit here, but that's just normal. I don't see any abnormalities, any swelling, any lesions, or anything like that, so I feel comfortable continuing with my assessment. First, I'm going to start on your right side, so your right clavicle. I'm going to go space 1. I'm listening to all 5 of your heart sounds. Rib 1, intercostal 1, rib 2, intercostal 2. All right. Now first I'm going to listen with my diaphragm for lub dub or S1 and S2. All right, that sounds good. Now I'm going to switch to my bell and listen for any heart murmurs. Good. No heart murmurs, and that was your aortic valve. This is your left clavicle, space. Rib 1, space. Rib 2, and space. All right. This is your pulmonary valve, or pulmonic valve. I'm going to listen for S1 and S2. Good, strong rhythm, and a good rhythm. Now I'm going to listen with my bell. All right, no heart murmurs detected. I'm going to go down to rib 3, space 3. Switch back over to my diaphragm, and this is Erb's point. And I am right here. S1 and S2 is good, and so is your rhythm. Now let me check for any murmurs. And no murmurs. So everything's good there. Now I'm just going to go up from the bottom of your bra, if that's okay?
Mm-hmm.
Okay. All right. Rib 4, intercostal 4, right there. All right. Oh, I'll go from the top. For reference, I'm right over here. Good. You have S1 and S2 in your tricuspid valve. Now I'm just going to check for any heart murmurs in your tricuspid. All right, good, and a strong rhythm too. All right, last one. I'm going to go down to rib 5, space 5, and I'm going to go over to mid-clavicular line, so right here. Switch fingers. All right, first I'm going to listen with my bell because I have to listen to your pulse for a full minute. All right, I don't hear any murmurs. Now I'm just going to listen to your apical pulse for a full minute. All right. Your apical pulse is 83, which is good. So now you can pull your gown back up. If you could pull your gown up to your bra line. All right. You could pull this down to your hips. Good. Maybe just a teensy bit more. Good. Now I'm just going to inspect. I notice you have a mole there, but it looks symmetrical and the color looks okay. All right, now I'm just going to look for any lesions. I don't see any, and I'm not noticing any lumps or any issues that I can see from here. Now I'm going to look for abdominal aortic distension from the side, and I don't notice any, and now I'm just going to check again from the bottom of the bed. All right, no aortic distension, which is good. So I feel comfortable continuing with this assessment. First, I'm going to start with auscultation. I'm going to start with your GI. So I'm going to start in your lower right abdomen. And I'm going to listen for 5 bowel sounds. 1, 2, 3, 4, 5. You're pretty active. Did you eat? Did you just eat?
A little bit ago.
1, 2, 3, I'm still above the belly button, but just barely. 1, 2, 3, 4, 5. Last one. 1, 2, 3, 4, 5. Good. So you are active in all 4 quadrants. So you have active bowel sounds times 4. Now I'm just going to listen to your cardiac system in your stomach. So if you could move your hands a little bit. Feel for your xiphoid process in your belly button. Meet in the middle. This is your abdominal aortic. And I don't hear any swishing or any bruise. Now I'm going to go down to your left renal, which is still above your belly button. Okay, no whooshing. Go up, down to the right renal. Still no whooshing. And I notice you're having some hives pop up. Are those painful?
No.
Okay, good. Right iliac. All right, good. Left iliac. Good. So I'm done with auscultation. I didn't hear any bruise in your renal, iliac, or aortic arteries, so I'm not worried about anything there. So I feel more confident by starting with percussion. So I'm going to start in your right lower quadrant. Good. So I heard tympany in all 4 quadrants, which is what we want to hear. No dullness or anything like that, which would indicate distension or an impaction. All right, now I'm just going to percuss up to your liver, and I should hear tympany to dull. Tympany, 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 a little bit, dull. So here's the end of your rib cage, and here's the start of your liver. So that's a good thing. It means you don't have any liver distension. All right. Now I'm comfortable with continuing on to palpation. I'm just going to have you tell me if you're feeling any pain during any of this. I'm also going to look at your face while I'm doing this to indicate if you're grimacing or having any pain. Good. I didn't notice any grimacing. Were you in any pain?
No.
Good. And I didn't feel any lumps or any issues, so I feel confident with doing deep palpation. Once again, let me know if you're feeling any pain. I'm going to look at your face for any grimacing or any signs. Still no pain, right?
Yep.
Good. All right. And I didn't feel any distension there either, so I'm not worried about anything with that. You can put your gown down to the lower end of your stomach. I do have to feel for your femoral arteries though. So I'm just going to expose this area. In order to feel these, I am going to need to go down your pants a little bit. Is that okay with you?
Mm-hmm.
Okay. So if you could sit kind of like in a frog position for me. All right. Let me move this down just a teensy bit more. Okay. And I'm just gonna feel this side, which is I'm right here. Same thing here. Symmetry is good. And this side, I'm right here. All right, so now I'm just going to auscultate for any bruise in your femoral arteries. I'm right here. Good, I don't hear any bruise. And I'm right here. And no swishing or any bruise on that side either. So I'm not concerned about anything there. Your femoral arteries sound good, both your right and your left. So you can put your legs back down. I'm going to cover you back up. And it's okay. And if it's okay with you, I'm going to start with your leg assessment. All right. So I'm just going to uncover your legs. First, I'm just going to inspect. Everything looks okay. I don't see any bruising. I don't see any lesions. I don't see any issues whatsoever. The color looks fine. I see a couple moles, but once again, they all look normal. So I'm not worried about anything there. So I feel comfortable with assessing for muscle tone. Temperature feels good. Right leg muscle tone is good. And the left leg muscle tone is good. And your temperature is good on both of those, so I'm not worried about you having any problems with that. Now I'm just going to assess for edema. There's no pitting. And I don't see any visible swelling. But there's no pitting anywhere, so I'm not seeing any edema, and we're not worried about that. All right, now I'm going to check your capillary refill in your toes. All right. Good. And good. It was under 3 seconds. It was a little closer to 3 because your toes are cold. So that's good. Now I'm just going to take a check in between your toes. Everything's looking good. And do you have any pain in your legs or your feet at all?
No.
Okay, good. So now I'm going to have you lift your legs up in like a crouch position. Yep. You're going to feel your popliteal arteries. This one's strong. Let me find that one. There. They're symmetrical and they're in a good rhythm. Now I'm going to feel your posterior tibialis. They're both symmetrical and strong. Now your dorsal pedis. And those are both good and symmetrical. All right, you can put your legs back down for me. Now I'm just gonna do a sharp and dull localization test. So I'm gonna have you close your eyes. This is sharp and this is dull. So I want you to tell me whether I'm touching you with the sharp side or the dull side and then where I'm touching.
Okay.
All right.
Right upper leg sharp. Left lower leg sharp. Left upper leg dull. Left knee dull. Right knee sharp. Right lower leg dull. Right top of my foot dull. Left top of my foot dull.
Good. So you got all those right, so I'm not worried about any issues there. And if you want to, you can take your time and you can sit up. Let me know if you're feeling any dizziness from moving. No? Good. Alright, I'm just going to tie this because we're going to be getting up soon. There it is. Okay, good. And now I'm just going to do a muscle tone or a muscle strength test like I did with your arms. It's going to be the same exact thing. I'm going to push out and I want you to push in. Good. Same the other way. Good. I'm going to push down on your toes and I want you to push up. Good. Same thing. Good. Alright, everything seems fine there. I'm going to do some range of motion tests. I want you to spin your ankles around for me. Good. Couple of crackles there. Is that normal for you?
Mm-hmm.
Any pain?
No.
Good. Alright, I'm going to lift this up a little bit. I'm going to have you straighten your leg, kick your leg out. Good. Good. Any pain there?
No.
Good. Now I'm just going to do your popliteal reflexes. Oh, close your eyes, please. That one's good. Good. Are they normally really strong?
Yeah.
Okay. Alright. And you're having no dizziness or anything?
No.
Okay, good. I'm going to have you put your socks and shoes on for me. Alright, we're going to stand up and I'm going to do a round bird test. So I'll stand right beside you. And I'm just going to have you stand with your feet shoulder width apart, hands by your side, and I'm going to have you close your eyes. Alright, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, you can open them. You had a negative round bird test, so I'm not worried about ambulating you. You didn't have any dizziness or any too much swaying, so I'm not worried about anything. You can take about 3 to 4 normal steps that way. Alright, and if you want to pivot around. And then back that way, you're going to do heel to toe. And if you could sit back down for me. Good. Now finally, I'm just going to do the Braden scale. So your skin doesn't look overly moist, so I'm not worried about that. Your diet is good, your mobility is good, your activity is good, and I'm not worried about any friction and shear because you can move around perfectly fine, and I'm not worried about any incontinence. So I give you a 23 on the Braden scale. And I think I'm finished with my assessment.